my name is Sharice Pittman, and I am going to conduct my health assessment video. And so, yeah, let's get started. I have my patient here, and we are going to get started. So, there we go. Hello, how are you, Caleb? My name is Sharice. I am going to be doing your physical exam today. How are you doing?
Good.
Good. Are you okay if your parents are in the room while we do this physical?
Yes.
Okay, thank you. If you just give me a minute, I'm just going to go over here and wash my hands. And I'm going to pull the curtain to provide some privacy while we do this physical assessment, okay? And so that's what I'm going to do. So I'm going to come over here. I'm going to wash my hands, and I'm going to pull the curtain to give Caleb privacy. Gather all my equipment here, and we are going to get started. Okay, Caleb, can you tell me your name and date of birth for me?
May 18, 2012.
Good, thank you. Can you tell me the date?
April 13th, Tuesday.
Okay, what year is it?
2026.
2026, correct, thank you. And how are you feeling today?
Good.
Good, I'm glad you're feeling good. Okay, so are you okay if I get a temperature on you, do your heart rate, get your blood pressure?
Yes.
You okay with that? Okay, so I'm going to use this thermometer here. If you can open your mouth for me, please, and lift your tongue up. Good, and I'm going to hold that there. All right, got your temperature. It's 98.6. Thank you for that. And then I am just going to feel your pulse here, if that's okay. And I'm just feeling to make sure that his pulse is normal, and get his heart rate, which I got a heart rate of 60. So good job. And now I'm just going to put the blood pressure cuff around your arm here, and then we're going to, you just hold your arm out for me, and then I'm just going to listen to it here. Okay, thank you. Just going to blow that up here. Good job. Got 113 over 68. And if you hand me your finger, I'm just going to check your O2 stats here. So go ahead and we'll put that on your finger there. Just kind of place your finger there. Kind of keep that stop. And good job. Good, got 98%. So everything looks good. Everything checks out. Now, if you don't mind, can you stand up? And I'm going to get your height. I'm going to get your weight first. So come over here to the scale. Okay, good. Good job. So that is 98 pounds. And so if I can get you to come back and then turn around and just kind of stand straight up, head straight, and make sure your back is across there. And then I'm just going to get your height. And we got about 4 feet 8 inches. Good job. You're growing. Go ahead and sit on down there, back in that chair for me. And now I just want to be able to just kind of observe his appearance. He is clean, he's groomed well, he doesn't have no odor, he is pleasant, he's cooperative, he is sitting up straight, and he looked like he is pretty healthy young boy, and he overall looks good as far as his appearance goes. And so now I just want to be able to check your head here. So Caleb, I'm going to inspect your head here. I'm just looking at his hair. I'm looking at his scalp, his hair, making sure there's nothing in it, no type of scabs, abrasions, no type of lice, anything like that. I just want to make sure that there's nothing going on that's worrisome in his scalp. Making sure that his skull is a good size, is normal, it is nothing bulging, no swelling anywhere. So that's what I'm going to expect to make sure. And then I'm going to go to his face here, and I'm going to make sure that his face is symmetrical, where it's not no asymmetrical places. So his eyes are lined up, his nose is lined up, his mouth, as well as his ears here. He doesn't have any type of facial drooping when it comes to his face. So everything looks symmetrical there. His skin is even toned. I don't see no discolorations. I don't see no scabs or any type of abrasions. Nothing where it looked like he's been cutting himself. He does have hair down here on his legs, both of his legs here, and his skin is warm and dry to touch. He has good elasticity of his skin. Nothing where it looks like that he is dehydrated. Now, Caleb, if you can you smile for me and clench your teeth? Big smile. So everything here is within normal. Everything is straight and everything looks good in that sense. If you don't mind, can you stick your tongue out? I just want to make sure that looks good. Good job. If you can puff your cheeks, can you go like this?
Cheeks.
And then your forehead, everything looks good. Your cheeks, your chin. We're just making sure that those areas look good. I'm going to palpate your temporal pulses here, making sure those are normal, those feel normal, everything like that. I'm also, as well, if you look up at me, I'm just palpating like his sinuses here. Make sure there's not no swelling, not no drainage coming out of there. I also want to make sure there's no drainage coming out of his ears here, as well as no crust in his eyes. I'm making sure that the whites of his eyes are not yellowish, pinkish. We're just looking at the colors there. When we do the test for our eyes, I want to make sure that visual from distance he can see, as well as his visual fields. So Caleb, if you can follow my finger here, just keep your head straight there for me. And as you can, I just want you to follow my finger this way, keeping your head straight, and this way. And then I'm going up, off to the side. You're not turning your head, you're just kind of keeping that so I can check your visual field here. And that is when it comes to our eyes here as well. So yes, Caleb, so I'm looking at his pupil size. You want to make sure you shine light into the eyes to make sure that you gain perla and that they're normal, and make sure they're not fixed or dilated. And then the Snellen and the Rathbone chart we're going to use as well. We will want to test his hearing by doing the whispering test, as well as using tuning forks when it comes to trying to see how he hears with his ears. Checking his ear canals with make sure that those are normal, as well making sure that there's not no anything coming out of those. Make sure it's not no wax buildup or anything like that. I as well want to inspect his neck here, and just feeling for his lymph nodes back here in his back of his neck. Make sure there's not no swelling, as well as I'm going to come to the front and come to the part of his trachea. Make sure his trachea is midline here, and making sure I don't see like a goiter in his neck area, and as well making sure that it is symmetrical when I'm looking at his neck. In his nose, I want to just make sure that his nose is not have no drainage, making sure that he can smell. We're going to use a pen light to look up his nose to check his mucosa, make sure it's not dry up there, as well as I want to have you open your mouth. When I'm looking in his mouth, I'm looking and making sure that his mucosa is pink, it's moist. I'm going to be looking at his throat, making sure there is no pus, no patches, nothing back there that is abnormal for those things. And then as well, when we make him say Caleb here. Say yes, thank you. Say and that's just kind of looking for that uvula and that soft palate. And those are the things we're going to look for when it comes to the mouth and throat of your inspection here. I am wanting to check your carotid pulse here, kind of going down in there, as well as if you look that way, Caleb, I will shine a light to look for, look at that jugular vein. And then I as well will have you turn that way, and I will come on this side as well and look at your vein that way. So that is what we'll do there for our neck, and inspecting our, make sure there's no type of venous distension or anything like that. Now I want to come to your chest area. I just kind of want to make sure, kind of look, if you come over here and lay down here on the bed here, I'm going to take a better look, listen to your lungs here. As well, if you can lay all the way down for me. Well, there you go, just lay down, good. And I'm going to take your neck. I'm going to listen to his lung fields here. You take a deep breath. And I'm just auscultating, listening to his chest. I am listening to the 5 different heart sounds, which is 5 different parts of the heart. And I'm going to go down here and go down here. Listening to that. I'm as well going to come and kind of feel and palpate his PMI as well, just to palpate, make sure that is all good there. And so, and we're also going to do some percussion where I'm taking my finger and I'm like tapping the finger, and I'm listening for the dullness, any type of sounds, abnormal sounds of his lung fields, and I'm going to do that posterior, laterally, as well as anteriorly. And again, I listen to the borders of the heart, and then so now I'm just want to look at his extremities here, both of his extremities, making sure he has hair here, making sure the skin is intact here, making sure his hands, he has all his fingers, looking at his nail bed, making sure there is nothing where anything look abnormal as far as his fingers. go. And so those are what I'm doing there. I assess his skin turgor. And then I want to as well move down to his lower extremities down here. Caleb, if you don't mind kind of sitting up a little bit more for me so we can see your legs here. Yeah, if you kind of move on back. There we go. So just kind of sit up. I'm as well doing the same thing like I did his arms, looking at his legs, feeling, touching, looking at his toes here. And so that way I can check that as well to make sure his skin looks good. Checking the turgor, make sure it's not no swelling, any painful, anything that is abnormal. If you can kind of lay flat, I'm going to look at your abdomen here, Caleb. So if you can lay flat again, I'm going to look at your abdomen here, Caleb. So yes, thank you. If you put your legs down here as well, I am going to listen, and I'm going to listen in all 4 quadrants of his abdomen. And what I'm basically doing is trying to make sure I hear his bowel sounds, and if they're hypo, hyper, or they're absent. And so we're going to listen to those bowel sounds. After you listen, I want to palpate, and I want to palpate, make sure he doesn't have any tenderness. In all 4 quadrants, I'm going to kind of feel, make sure there's no, it's soft, make sure it's not no firmness, just want to also make sure none of the organs like the liver, the spleen, the kidneys, any enlargement that we could possibly be missing. And so any type of ascites, we're testing for the shift, for the dullness, and we're doing the same thing like we did on the chest, where we're percussing, and we're just kind of, and we're doing that in all 4 quadrants here. And so that is what we're doing as far as our abdomen. And yeah, and then again, we're testing, we want to test for our back, Caleb. So if you stand up for me, Caleb, I'm going to just look at your spine, Caleb. If you stand, I need you to stand up, huh? Yeah. If you can bend down for me, just straight down. And so I'm just going to be looking for his, making sure his spine is normal, making sure it's straight, making sure it's not no scoliosis here. And then I want to test your sensation. You can sit. I want to test your sensation of your fingers. Okay. So I'm just testing here. Palpating these muscles here, back here, your muscles. You squeeze my hand. Squeeze my hand. Yeah, squeeze both of my hands. Good. Now prevent me from touching. Sit up straight. Sit. Okay, go. Prevent me. Same thing with your legs here. I don't want you to prevent me from try to push your legs out. Good. Awesome. And so I need you to come and sit back in this chair for me. If that will be good. And so overall, Caleb looks healthy. And he, I'm done with his head to toe assessment. And thank you for this time and allowing me to kind of go over the body with you. Thank you.